Hey tribe, welcome back. In today's video, we're going to be going over therapy modalities, so stay tuned. First up is psychotherapy or talk therapy. So, according to the National Institute of Mental Health, refers to a variety of treatments that aim to help a person identify and change troubling emotions, thoughts, and behaviors. Most psychotherapy takes place when a licensed mental health professional and a patient meet one-on-one or with other patients in a group setting. A variety of psychotherapies and interventions have shown effectiveness in treating mental health disorders. Often, the type of treatment is tailored to the specific disorder. And in short, psychotherapy or talk therapy is broad, tailored to the individual, and can be long or short term. Duration, again, it can be short, medium, or long term. And the source right here, I'm going to put the sources in the description below. Next up, we have cognitive behavior therapy or CBT. According to the Beck Institute, CBT is based on the theory that the way individuals perceive a situation is more closely connected to their reaction than the situation itself. Individuals' perceptions are often distorted and unhelpful, particularly when they are distressed. Cognitive behavior therapy helps people identify their distressing thoughts and evaluate how realistic the thoughts are. Then they learn to change their distorted thinking. When they think more realistically, they feel better. The emphasis is also consistently on solving problems and initiating behavioral changes. The cognitive model describes how people's thoughts and perceptions influence the way they feel and behave. The cognitive model is at the core of CBT, and it plays a critical role in helping therapists conceptualize and treat their clients' difficulties. And they're referring to the CBT triangle. Cognitive behavior therapy, or again CBT, is a time sensitive, structured, present oriented psychotherapy that has been scientifically tested and found to be effective in more than 2,000 studies for the treatment of many different health and mental health conditions. When implemented correctly, CBT helps individuals get better and stay better. In short, CBT helps people identify and change their negative and unhelpful thoughts into more positive and realistic thoughts, which improves their mood and behavior to better solve their problems. And again, the CBT triangle. Duration, short to medium term. And on the exam, I don't believe it's going to ask, hey, is CBT short term, medium, or long? Because technically, it can be short or medium, but it's generally not considered a long term therapy. Like we're going to get into some other ones later in this video, but just it's here if we need it. Next up, we have rational emotive behavior therapy or REBT. In short, places a strong emphasis on philosophical principles, particularly the idea that irrational beliefs and rigid thinking patterns lead to emotional disturbances. And they also have something called the philosophical principle, a fundamental idea or belief that guides how we think about and understand the world, our values, and our actions. It provides a foundation for our thoughts, decisions, and behaviors. And I know some of us be thinking like, wait a second, that sounds a little bit like CBT. So REBT versus CBT. CBT also addresses irrational thoughts and behaviors, but tends to rely on evidence-based techniques to modify negative thought patterns and behaviors. It may not emphasize philosophy as much as REBT does. And the duration for REBT, short to medium term. So as we see here for REBT versus CBT, with CBT, it more so relies on evidence-based practice versus REBT that's more philosophical in its approach. Next up, we have Dialectical Behavioral Therapy or DBT. According to DBT Linehan, Dialectical Behavioral Therapy or DBT is a comprehensive, multi-diagnostic, modularized behavioral intervention designed to treat individuals with severe mental disorders and out of control cognitive, emotional, and behavioral patterns. It has been commonly viewed as a treatment for individuals meeting criteria for borderline personality disorder or BPD with chronic and high risk suicidality, substance dependence, or other disorders. However, over the years, data has emerged demonstrating that DBT is also effective for a wide range of other disorders and problems, most of which are associated with difficulties regulating emotions and associated cognitive and behavioral patterns. With DBT, they also have something called phone coaching. Clients have access to their DBT therapist for assistance with their day to day life when they need help applying skills. It is not therapy over the phone, it is coaching of skills in the moment. And the skills training, typically associated with core mindfulness, emotion regulation, interpersonal effectiveness, and distress tolerance. In short, primarily used for individuals with borderline personality disorder. And I know we just read where it can be used for other issues, but primarily DBT is used for clients with borderline personality disorder. And Marsha Linehan, the creator of DBT, designed it for that purpose. And duration, medium term. And again, I'll put the link down in the description below. Task centered slash problem solving therapy. So, in short, this approach is based on the idea that individuals have specific problems or difficulties that need to be identified and solved. Emphasizes problem solving techniques and structured tasks to address specific problems systematically. Helps the client identify the underlying causes and factors contributing to the problem. The therapist takes a more directive role, providing structured problem solving tasks, strategies, and interventions to guide clients in addressing their problems. And the duration is typically short term. Now we have solution focused brief therapy, or CFBT. In short, the focus is on what clients want to achieve in the future rather than dwelling extensively on the problem itself to obtain quick and tangible results. The therapist approach is more collaborative and client centered stance. Therapists ask questions to help clients explore their own solutions and encourage them to take an active role in setting goals and implementing changes. Therapists explore what is already working in the client's life and how those strengths can be applied to find solutions to their problems. In the duration, as the name applies, solution focused brief therapy, this is considered short term. Gestalt therapy, in short, the focus is on the present moment and the client's awareness of their thoughts, feelings, and behaviors. Emphasizes personal responsibility and the exploration of one's experiences in the here and now, so present moment. Therapists work to help clients gain insight into their patterns of behavior and unresolved emotional issues by encouraging self awareness, exploration of feelings, and direct confrontation of issues. And they also have the empty chair technique, a role playing exercise where the client sits in front of an empty chair and has a dialogue with whoever they imagine in the empty chair. The person they imagine can even be an aspect of themselves, such as the quote unquote angry or self critical part of themselves. And there's also another technique associated with Gestalt, exaggeration. The therapist keenly observes a client's body language, so whether like they're slouching, frowning, leg bouncing, etc., and instructs the client to reenact and exaggerate those specific movements to identify the link between their emotions and physical expressions. Clients are encouraged to use I statements to learn personal responsibility, and the duration is generally considered medium term. Now we have psychoanalytic or psychoanalysis theory and psychodynamic theory. And I put this here just to give a little bit of background before we dive into the actual therapy modalities. These are theoretical frameworks that were designed by Sigmund Freud and later expanded upon by other theorists. These theories are primarily concerned with explaining how the mind works and how psychological issues develop. They provide a comprehensive understanding of human personality, behavior, and the role of the unconscious mind. They explore concepts such as the unconscious mind, defense mechanisms, and the influence of early childhood experiences on adult functioning. And that sets us up right for discussing the therapy styles. So, psychoanalytic or psychoanalysis therapy and psychodynamic therapy, both of these therapeutic approaches are based on psychoanalytic theory and psychodynamic theory. They both share the goal of exploring the interplay between past and present experiences for personal growth and emotional healing. The main differences lie in the intensity, focus on the unconscious, therapeutic techniques, therapist role, and duration of treatment. First up is Psychoanalytic or psychoanalysis therapy, a comprehensive and highly structured form of therapy that often involves multiple sessions per week and can extend for several years. Exploring the unconscious mind through techniques like free association, dream analysis, and transference to gain insight into the client's emotional and psychological conflicts. The therapist typically maintains a neutral stance and remains somewhat distant from the client to facilitate transference and countertransference dynamics, places a strong emphasis on the Oedipus complex, and focuses on the past regarding the role of early childhood experiences in shaping adult personality. And the duration, uh, typically considered long term and can last for several years. Again, that was psychoanalytic or psychoanalysis therapy. Now, looking at psychodynamic therapy, this is a broader range of therapeutic approaches with an emphasis on the therapeutic relationship and the exploration of the unconscious mind. Less intensive, so they do weekly and bi weekly sessions, and more adaptable to the individual needs of the client. It touches on the past, but not solely focused on the past. The goal is to help individuals gain insight into the interplay between their past and present experiences, leading to personal growth and emotional healing, and the duration, medium to long term. Now let's look at narrative therapy. In short, a psychotherapy that focuses on the stories or narrative people tell themselves about their lives and experiences. It is based on the idea that individuals construct their understanding of reality through the stories or narratives they create. Clients are encouraged to externalize their problems, viewing them as separate from themselves. This helps them see the problem as something they can work on, change, or overcome. Social workers act as collaborators, actively listening to client stories without judgment and helping them explore alternative perspectives and solutions. Social workers help the client to reauthor or rewrite their life's narrative by changing the negative stories they have been telling themselves into more positive and empowering stories. And the duration, short to medium term. Now looking at sensate focused therapy, in short, primarily used with couples to address and improve sexual intimacy using physical touch exercises. Duration, short to medium term, and memory tip, this therapy is focused on the sensation of touch. Then we have emotionally focused therapy or EFT. In short, primarily used with couples by helping them focus on their emotions. The therapist helps the couple identify and express their emotions, explore underlying attachment needs, improve communication, and enhance their relational dynamics in order to strengthen the emotional bond between couples, resolve conflicts, and create more secure and satisfying relationships. And the duration, generally considered medium term. Now we have logotherapy. In short, a psychotherapy approach that helps individuals find the meaning, purpose, or logo of their lives. And you know, with a logo, it's like the main thing, like the symbol that represents the company, the business, etc. Existential frustration. This occurs when an individual feels a sense of emptiness or meaningless in their lives, which can lead to psychological and emotional problems. Emphasizes the idea that people have the freedom to choose their attitudes and responses to life changes, even in difficult circumstances. And duration, typically considered short to medium term. Then we have feminist therapy. In short, a therapeutic approach that originally emerged as a response to the unique challenges and inequalities faced by women. It has evolved over time to address broader issues related to gender and power dynamics. Based on feminist principles and aims to empower individuals by recognizing and challenging societal norms, stereotypes, and systems of oppression that can negatively impact the mental and emotional well being of individuals, particularly women and marginalized gender groups. Duration, it could be short, medium, or long term. Now let's take a look at trauma informed therapy. In short, a therapeutic approach that recognizes the impact trauma can have on the various aspects of a person's life. It creates a safe and supportive environment for healing by prioritizing safety, trust, and empowerment while avoiding re traumatizing the individual. It can be provided individually or in a group setting and aims to address the physical, emotional, and mental effects of trauma. The goal is to help individuals recover, build resilience, and regain control over their lives after experiencing trauma. Often integrates other therapeutic modalities, and the duration is considered medium to long term. Then we're going to get into prolonged exposure therapy. In short, a type of exposure therapy that's comprehensive, structured, and specifically designed for the treatment of post traumatic stress disorder or PTSD. It involves both imaginal exposure, so that's revisiting and discussing traumatic memories, and in vivo exposure, so facing situations or places associated with the trauma to help individuals make sense of their traumatic experiences and reduce the distress associated with them. In duration, consider short to medium term. And exposure therapy, in short, broad, less structured, and more flexible than prolonged exposure therapy. This used to treat a wide range of anxiety disorders such as specific phobias, social anxiety disorder, and PTSD by exposing individuals to feared or anxiety inducing stimuli. In systematic desensitization, this technique involves creating a hierarchy of feared situations or stimuli, starting with those that induce the least anxiety and gradually progressing to more anxiety provoking ones. Clients are exposed to these situations incrementally until their anxiety decreases, desensitization, and the duration typically considered short to medium. Then we have eye movement desensitization and reprocessing, or EMDR. In short, the social worker leads the client through eye movements, so side to side, or tapping while the client focuses on traumatic and distressing memories to reduce emotional distress and change negative beliefs the client has about the memory. Duration, medium term, and memory tip, the social worker helps the client desensitize and reprocess the traumatic / distressing event by moving their eyes. And just like I do with the disorders of reading them backwards, if we read these modalities backwards, it can help tell us what it relates to, what it addresses. So if we get any of these questions on the exam that's pretty much saying, hey, social worker, what's the preferred therapy modality? This can help tell us what it relates to. Okay, tribe, that's it for today's video going over therapy modalities. Don't forget to like, comment, and subscribe, and tell a social worker friend because we don't want to be licensed by ourselves. Again, I'm going to put the resources in the description and in the comment section below. And the description also has some helpful information as well. And I know when it comes to this exam, it's like, right? When it comes to these therapy modalities, this is more so that recall definition-esque type of questions that we'll get on the exam, where I say treat it like Jeopardy or match the peanut butter with the jelly. So when I say Jeopardy, you know how the host will describe something and then they want you to contestant to hit the buzzer. What is CBT? You are correct, right? And it's more so when you look at these questions where they want you to identify the correct therapy modality, they're going to describe what it is. Can we identify what's being described to us, or even matching the peanut butter with the jelly, where if a client is talking about difficulty managing their negative, unhelpful thoughts and everything, they're more so talking about cognitive behavior therapy, right? If it's talking about working a client with borderline personality disorder, most likely talking about DBT. If they're talking about short term, as mentioned in the question, is not long term, we don't want to pick something regarding long term therapy, which would be something like psychoanalytic or psychoanalysis therapy. Or if they're mentioning something very specific for that modality, like the empty chair technique, or they're talking about Gestalt therapy. So again, Jeopardy. What is the host describing? Matching the peanut butter with the jelly. And you know how I say, you got this. The license is already ours. We just got to go get it. And just bringing in some motivation. It's okay. It's okay because it's okay. We're going to stay consistent with our studies. 2 practice questions a day, 1 practice exam a month. Find a study buddy, because this information is retained a lot easier if we're having a dialogue about it with our study buddy, so we get to hear ourselves, so it doesn't always just kind of stay in our mind when we're reading a book or just looking at the video. We actually get to have a dialogue about this information. Definitely helps with the studying process. So again, you got this. We got this. All right, tribe, I'll see you next video.